In today's Wellness Wednesday, we're talking about seasonal affective disorder. It's a form of depression that affects millions of people every year. Joining me is Dr. Denise Lash, the Director of Behavioral Therapy at Intermountain Healthcare. Dr. Lash, thank you so much. Tell us, what causes seasonal affective disorder and how can it go about being diagnosed and addressed?
So seasonal affective disorder is a notable change in mood that usually has an onset in fall and lasts throughout the winter months. And this corresponds with the decreased daylight that goes with the seasons, as well as how we spend more time inside when it gets colder, thereby further decreasing our exposure to sunlight.
And I assume in Utah, that's probably a big issue.
Yes. Yeah, sure. It is more pronounced the further away you get from the equator. And so when we have these decreases in exposure to sunlight, a few things happen. It throws off some of our circadian rhythms. It can decrease our melatonin production, which is something the brain produces to help with sleep. And it can trigger a decrease in the amount of serotonin we produce. And serotonin is related to depressed mood, with higher levels of serotonin being related to, more positivity, and lower levels being related to more depression.
So some big symptoms and some big issues associated with this. Is there a particular age group or gender in which you see more of this in?
Slightly more common in women, slightly more common in younger adults, but, it definitely affects people of all ages and, affects men as well.
Dr. Lash, where can people turn if they are having these feelings of depression, and perhaps this could be exactly it? Where can they get that help?
Well, I think, going to see your primary care provider is always a good step. If you, are feeling, more in crisis, there's always helplines, including the Utah Crisis Line. There's also a number of treatments you can do at home. So since this is related to a decrease in sunlight, just simply exposing yourself to more sunlight can help. That can be, time outside on, bright blue sky, low inversion days. You can also get a light box. And if you do that, you want something called 10,000 lux for your box, not a UV lamp. You need that 10,000 lux box to mimic the sunlight you're used to getting in warmer months. Increasing exercise, always a remedy for things, and certainly no different here. Even indoor exercise can help. Last but not least, simply planning things you enjoy doing and doing them helps with all types of depression, including seasonal affective disorder.
Fantastic tips. And remember, the sunlight can be cold air sunlight this time of year here in Utah. It doesn't always have to be that warm air sunlight. Dr. Lash, thank you so much. We'll put these tips along with the phone numbers you gave us as well on our website so people can find them. All they have to do is go to fox13now.com. Dr. Denise Lash with Intermountain Healthcare. Thank you.
Thank you.